Anti-emetic drugs. Vomiting occurs due to stimulation of vomiting center in lateral medullary reticular formation. It receives input from GI mucosa, chemoreceptor trigger zone, and vestibular apparatus. Irritation of GI mucosa by drugs or irritants leads to release of serotonin that stimulates vomiting center via 5-HT3 receptors. Chemoreceptor trigger zone is rich in dopamine D2 and serotonin 5-HT3 and neurokinin NK1 receptor. Motion sickness occurs due to stimulation of vestibular apparatus and cerebellum. These structures result in stimulation of vomiting center by activating M1 and H1 receptors. By stimulation of H1 receptors, histamine plays a permissive role in all types of vomitings. Vestibular system has M1 and H1. GI has 5-HT3. Both stimulate vomiting center. Vomiting occurs. Chemoreceptor triggered zone has dopamine, neurokinin, 5-HT3, that is serotonin, which stimulates vomiting center, and vomiting occurs. Drugs for motion sickness. Hyoscine is used as IM injection or transdermal patch applied behind pinna for prophylaxis of motion sickness. It has no role in treatment once vomiting starts. Antihistaminics like promethazine, diphenhydramine, cyclizine or meclizine can also be used for prophylaxis. Cinnarizine, antihistaminic with anticholinergic and antiserotonergic properties, is used for treatment of vertigo. Drugs for morning sickness. Combination of doxylamine, antihistamine with pyridoxine vitamin B6 in high dose is safest antiemetic drug in pregnancy. D2 blockers, although effective, should not be used due to their teratogenic potential. Drugs for chemotherapy and radiation therapy induced vomiting. 5-HT3 blockers like ondansetron, granisetron, dolasetron, palinosetron, and ramosetron are drug of choice for this condition. Palinosetron is most potent 5-HT3 blocker. Dolasetron may prolong QT interval. Palinosetron has longest T half-life, whereas ondansetron has shortest T half-life. Efficacy of these drugs increases if used along with antihistaminics, D2 blockers, and dexamethasone. These drugs are also effective in hyperemesis of pregnancy and postoperative nausea. D2 blockers like metoclopramide and domperidone can also be used. Vomiting due to cisplatin, most emetogenic anti-cancer drug, can occur within 24 hours or it may be delayed after 2 days. Drug of choice for the former condition is 5-HT3 blocker, whereas for later condition, drug of choice is aprepitant substance P antagonist. Palinosetron may also be effective in delayed emesis. Aprepitant is a highly selective NK1 receptor antagonist, orally active and enters the brain. It is metabolized by CYP3A4 enzymes and can also inhibit the metabolism of drugs metabolized by this enzyme. Example, warfarin. Fosaprepitant is an intravenous prodrug of aprepitant. Netopitant is a newer NK1 antagonist approved for chemotherapy-induced vomiting, both acute and delayed in combination with palinosetron. Rolapitant is recently approved NK1 antagonist for delayed vomiting. Dronabinol can be used in patients not responding to other drugs. Drugs for post-operative vomiting. 5-HT3 antagonists are preferred over other drugs. Amisulpride D2 antagonist can also be used for this indication. Emetic drugs. Apomorphine and ipecacuanha can be used to produce vomiting for treatment of poisonings. Emetics should not be used for kerosene and corrosive, acid and alkali poisonings.